Good morning, everyone, and welcome to the House Committee on Health and Human Services and Elderly Affairs. We have a full day of hearings scheduled on 5 different bills, but before we get to those, I'd like you to please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you, everyone. The first bill to be heard today is House Bill 72, and I will recognize the prime sponsor, Representative Jess Edwards. Good morning.
Good morning, Mr. Chair and members of Health and Human Services Elderly Affairs. I'm Representative Jess Edwards. I represent Rockingham District 31, which is Auburn, Chester, Candia, and Deerfield. I'm an alum, a longtime alum now of this committee, and so it's always good to come back and visit with you. Today's bill, House Bill 72, extending the commission to study telehealth services is very short, very easy to wrap our head around. If you look with me on the page with all the writing, I'd encourage you to start at line 14. Basically, what we're doing with this bill, this is a study group that whose time has come and gone. It's expired, and we've published our final report. As we were coming to a conclusion, we started to talk about whether coming to an end was the right thing to do, and it was a strong belief of that committee that we should just do one more report, a supplemental report. Why would a supplemental report be a reasonable thing to invest in? It's because the final data that we used to do the final report was heavily influenced by COVID. And COVID, we concluded, really had an impact on the way in which telemedicine was used. An original purpose of the committee was to determine what the natural, normal trends are these days with telemedicine, and to help determine whether or not there were things that could be done to encourage its acceptance and growth under the belief that it's a vital tool in improving the tripod of access, cost, and quality. And because we think it's an important emerging thing, and because we think we had skewed data from COVID, we wanted to let it run another couple of years so that we could get status quo data and to include it in the supplemental report. Now, if you jump up to line 8, we determined that the original charter of the committee was just a little incomplete and would have been better had we also taken a look at federal policies, explicitly look at the federal policies to see what the trends were there to encourage or maybe discourage telemedicine. That's entirely possible, but we didn't look at the federal policy issues. And then there was no charter for the committee to potentially recommend any legislation. Not that there is legislation we'd recommend, but we just wanted to make sure that the members of the committee knew that that was a possibility if we saw something that was worthwhile. So, so that's what HB 72 does. It extends a dead committee and lets us go get better and more complete status quo data. It has us increase our charter to take a look at federal policy to make sure we're in sync, and gives us an invitation to recommend legislation should it be appropriate. So that's the bill. Dr. Palmer, Representative Palmer, is on that committee too, and he was a part of these recommendations. I think he's a co-sponsor. Yes, he's a co-sponsor. So after I leave, you got people to ask, okay, what do you really think? And so I'll take questions if there are any, Mr. Chair.
Sure. Representative Woods.
Thank you, Mr. Chair, and thank you for taking my question. I've been involved with telehealth here in the state for probably the better part of 30 years.
All right.
My question is was there any consideration to making this a continued committee? Because judging from, at least from what I continue to read in my interaction with some of the national organizations, about the time you finish this report, is going to be time for another report. Things are changing so fast, especially with AI, its integration. The American Medical Association is a big player in this arena. A number of independent organizations are really being big players, and I'm just curious. It seems like this would be something that would best be served with almost a standing committee at the risk of offering another committee. But was there any consideration?
Thank you for the question. I think it wasn't an explicit consideration. What we were looking at was this particular committee was terminated at the end of the final report, and we thought that we really weren't done. I agree with your long-term vision. I first got into telemedicine, believe it or not, in the 60s at the University of Nebraska with their program when I was just a kid and I was interning as a volunteer. And then as a DOD telemedicine testbed deputy director in the 80s. So I believe, as you seem to, the potential for virtualizing the healthcare system and telemedicine is going to be maybe the backbone of that. And then over time, we'll be able to add other components, like we're going to continue to add the diagnostics, we're going to do the AI. And so I would like you to know that I agree with you, and that the charter that you're asking for can be carried over into a longer term committee, the Emerging Medical Technologies Committee, which I chair, and we're going to have our first meeting in February. And that's the sort of topic that that we would like to include in that committee, because there's going to be this massive convergence of technologies that are going to create potentially a new sort of virtual environment. Now, because healthcare moves slowly, that could be 20 years, but I think your sense is right. I would recommend at this point to just keep this bill narrow, just extend this one more time. That'll give us time to synchronize it and interleave it with the Emerging Medical Technologies Committee, and I think your objective would be met that way.
Follow up.
This is educational for me. I was out of the legislature for a semester.
We missed you.
But the emerging technologies, as you know, I was originally a physicist, and I'm very interested in the emerging technologies. This is a sidebar, but is that a standing committee or?
We set that up for a 5-year life, not knowing whether or not
I'll touch bases with you.
Yeah,
offline.
yeah. Let's talk about it. I think the timely aspect of this is, if you're interested in that committee, we're interested in having a Democrat added to it. We lost one to retirement, so you could talk to your leadership, and I don't think it's all been appointed yet.
Other questions? Representative McGrath.
Thank you. I was wondering if you could expand on what synchronization with federal policy. Does that mean that we would have to follow whatever the federal policy is?
So as you know, federal policy, if it comes with money, usually comes with strings, and synchronization in that regard would be, if we want their money, we do what they want. Synchronization beyond that, though, could be the extent to which they include any research or any findings or any recommendations. I don't know what I don't know yet about that. I do know that the Department of Defense still has a version of the organization I was in the 80s that explicitly looks at these emerging technologies and telehealth. And I intend to go visit with them to find out what they are doing at the federal level and what issues they're bringing in. So I want to create a communication channel. So some of it, if we want their money and there is money, then we would do it. And otherwise, it's just being informed so that we have a better sense of the future.
Other questions? Seeing none. Thank you.
All right. Thank you very much. Have a good day.
Yeah, you too. Also signed up to testify is Holly Stevens with NAMI of New Hampshire. It's okay.
Good morning, Chairman, members of the committee. My name is Holly Stevens, and I'm the Director of Public Policy at NAMI New Hampshire, the National Alliance on Mental Illness.
For the benefit of some of our newer members, could you tell us what NAMI stands for?
The National Alliance on Mental Illness.
Okay, thank you.
You're welcome. NAMI New Hampshire is a nonprofit grassroots organization whose mission is to improve the lives of all people affected by mental illness and suicide through advocacy, education, and support. And I'm here today to speak in support of House Bill 72. During the time that it was meeting since 2020, I served as the representative from a nonprofit social services organization representing the patient perspective, and was a part of that commission as it did a lot of good work and learned a lot from the data. And a couple of things that the data showed, particularly when it comes to mental health, is that mental health psychotherapists and substance use counselors, about half of their appointments are telehealth appointments. And the other thing that we found was from the claims data that was provided by the New Hampshire Insurance Department and the Department of Health and Human Services was that 80 to 90% of all claims filed for telehealth were behavioral health claims. So this is particularly important in the mental health care workforce crisis that we're facing, as well as the access to care that we're facing with folks who may not have transportation. They may live in rural areas where there's not a lot of providers, or may have things like childcare or work. Our executive director has been going into places, employment workforce companies, in talking with them about how they can use telehealth for their employees to support them, so that if they have a mental health appointment, they can go to a room, have that appointment, and then carry on with their day without having to actually leave. So telehealth is going to be critically important as we try to deal with a lot of workforce challenges across the sector. And for those reasons, we're in support of this bill. We know that the work is not done. The commission found that this is an evolving the data is still evolving on this, and we are just coming down from COVID and seeing where it's going to all shake out. So for those reasons, we are in support of this bill, and I will take any questions if you have any.
Thank you. Any questions? Seeing none.
Thank you.
Thank you. Also signed up to speak is Representative William Palmer, a member of our committee and a co-sponsor of this bill.
Thank you, Mr. Chair. I just wanted to take a minute to say that I've been going around to various places, specifically medical staff at Valley Regional and my hospital, Mount Ascutney, and talking to them about how important this area is to me, is to them. And they are now regarding it as sort of a critical piece of primary care access, and their biggest concerns are that that some of the agencies like Medicare they've been talking about whether they continue to pay for it, and so that's part. So I think continuing to study this and figure out how all these pieces go together is critical, which is why I'm really in support of this bill. I don't really have anything more to say to that except that there's a broad support from the medical community, and given the lack of primary care access in New Hampshire, pretty much anything we can do to improve that is key. So I'll take any questions if anybody has any.
Any questions? Yes, Representative McLean.
Yes, thank you, Mr. Chair, and thank you, Representative Palmer, for taking my question. So you mentioned that some of the funding and coverage might be under threat. I thought you said Medicaid. Is hearing the same thing from private insurance and others as well?
It's sort of an ongoing thing, and right now, I know sort of the American College of Physicians is doing a lot of lobbying to maintain coverage, and some of it's not that they're going to stop coverage altogether, but it's whether it continues to be fully funded, and for what. The other areas that are important is, for example, if you're a physician in Vermont and your patient is in New Hampshire, there are a lot of issues like that really are sort of going to be very important to solve, so that telemedicine really can be as helpful as it can be, because we have a lot of border everywhere, and so all of those issues. Right now there's no one thing that I'm particularly worried about, but it's the whole spectrum of availability of services.
Yes, Representative Woods.
Thank you, Mr. Chair, and thanks for taking my question. As with electronic medical records, for the private practitioner, there is always an ancillary financial burden to set up the software, have somebody who could maintain it. That's an extra charge, an overhead. Is there a similar sort of number that you can put your thumb on about, is there a similar overhead, shall we say, for, you mentioned expanding the primary care, but the downside is you have to have the proper environment. And to create that, what's that burden?
So I don't know the whole answer to this. Because the part of the answer I don't know is what private practitioners who may not be using an electronic medical record are doing, and how that might work. In other words, sure, they can do it over their, iPad or on the computer, but how does that fit in? In a lot of...
I didn't mean to I used the electronic medical record just as an example.
Right.
But as a standalone.
So the practices at Mount Ascutney and Dartmouth Hitchcock Health has a whole sort of system built into their electronic medical record, which must have taken something. And there is a whole thing that you have to follow where you have to document that this is a telehealth visit. And so there's extra time. If you look at these notes, half the note is sort of documentation of so there is some extra burden there, but overall that the practitioners are like, maybe so, but it's still really an important.
Representative Weber.
I had just a point of order, Mr. Chairman. Isn't it true that we have a relatively short period of time to deal with the bill? And the bill is about a study committee to
Right.
study these issues. So I'm wondering if we should try and limit our questioning to the study committee rather than the underlying issues that all of us are really very, very interested in. Because
So please come to the study meetings.
Other questions? Okay, seeing none. Thank you. I have no one else signed up to testify on House Bill 72. Does anyone else wish to testify? Seeing none, seeing no one, I'm going to close the public hearing on House Bill 72. Our next hearing is in 10 minutes on House Bill 50. So again, I'm going to close the public hearing on House Bill 72. Our next hearing is scheduled in 10 minutes at 10 a.m. on House Bill 58, so we'll be in brief recess. Representative Renati will introduce HB 370 because it has a conflict. So he sent me testimony like introduce the bill. I got your email.
He's not here today, but he was just here testifying.
No, he was here.
It was right there. Okay. I was a little late, so.
Came in just after.
Is there anyone else who is missing or has been substituted?
Chris Seibert is going to come in. But not here yet.
Well, apparently, from what I've, the information I've seen.
Number on where I parked my car, I'm gonna be cold. Thank you. Yes, Chris up for next week.
Got it, okay. That's
Just to confuse you a little more.
Let's fix this.
We were forehanded with the role because he told me yesterday that he couldn't be here next week. And because Chris was sitting here, I said, please give me a call. And she said, yes.
Representative Thomas, do you like?
Well, actually, I have
better than us or us better than?
Oh, hands down, you guys are better. If
But
I-
no pressure.
I know, no, if I wasn't on science and tech, I would be, I love it. You guys don't seem to have as many fights.
I knew, maybe it's actually a fight.
It is, I mean, we don't have fights. We have passionate discussion.
I'm just following up with a call I made to my colleague. Health and Human Services oversight is meeting tomorrow. And neither Terry Wood nor I have any indication that we are actually reappointed to the committee. And if I look online, it still has Terry Wood.
Did you get a chance to
Our meeting, which is your.
We're asking about.
Yeah, you know, I'm gonna actually, I make jewelry, so I can like figure out how to do that.
Do you really?
Oh, I make that.
Let me see. Oh. Yeah, yeah.
We'll be there.
Yeah. Yeah. But is that your will? Oh, really? Right. Oh, yeah. Oh, so I will sign it for you.
I like that.
Now they don't have smart locks. So what the heck do you do?
So Jim was saying how cold it is, I would ask. Because I'm a maritime, you know, but, yeah.
But, and you can swim well into, I mean, my sister and I went to PEI in
Yeah.
October and swam because the Gulf Stream.
It's 10 a.m., and I'd like to recognize the prime sponsor, Representative Wendy Thomas.
Thank you, Mr. Chair and members of the committee. For the record, I'm Wendy Thomas, and I represent the town of Merrimack. Yesterday, I emailed you a copy of this report, and I'm going to be referencing it. So it's in your email box if you haven't seen it yet. HB 58, which establishes a committee to study legislative protections and accommodations for individuals with long COVID, is a good idea for several reasons, particularly when considering the economic impact referenced in the New Hampshire Fiscal Policy Institute report, which you have all been mailed. Long COVID is defined as a chronic condition that occurs after SARS-CoV infection and is present for at least 3 months. Long COVID includes a wide range of symptoms or conditions that may improve, worsen, or be ongoing. Anyone can get long COVID. Long COVID occurs more often in people who have had severe COVID illness, but anyone who gets COVID can experience it, including children. Most people with long COVID experience symptoms days after first learning they had COVID, but some people who later develop long COVID do not know when they were infected. People can be reinfected with COVID multiple times. Each time a person is infected with COVID, they have a risk of developing long COVID. Long COVID symptoms and conditions can emerge, persist, resolve, and reemerge over weeks and months. These symptoms and conditions can range from mild to severe, may require comprehensive care, and can even result in a disability. While rates of new cases of long COVID have decreased since the beginning of COVID, it remains a serious public health concern as millions of U.S. adults and children have been affected. The New Hampshire report, highlights that almost 17%, roughly 4,000 people, of the state's working age population have experienced long COVID. This significant percentage demonstrates the potential for long-term economic disruptions, including individuals with long COVID who often experience debilitating symptoms, making it difficult or impossible to maintain consistent employment. This affects overall productivity and increases dependency on disability benefits. Also, many affected individuals face prolonged unemployment or underemployment, which leads to reduced household income and decreases consumer spending, which also affects the broader economy. Long COVID leads to ongoing medical expenses, including treatments, diagnostic tests, and rehabilitation services. For individuals and families, those costs can be devastating, especially for those without adequate insurance. On a systemic level, increased healthcare demands strain public and private health resources. This bill wisely acknowledges that long COVID disproportionately affects marginalized communities, which are more likely to work in high-risk, low-paying jobs without adequate health benefits. And they also have limited access to healthcare and financial safety nets. Targeted legislation efforts would reduce those inequalities by improving access to accommodations and protectors. By involving multiple sectors, healthcare, employment, education, and social services, the committee can propose holistic solutions to minimize long-term economic and social disruption. Coordinated efforts are essential to address the interconnected challenges posed by long COVID, such as ensuring workplace accommodations and streamlining access to healthcare and disability benefits. The evolving nature of long COVID demands a proactive approach. Establishing a dedicated committee ensures the state can respond to new research and emerging challenges efficiently, minimizing economic fallout and improving public health outcomes. Given the widespread and long-term economic impacts of long COVID on individuals, families, and the state, this bill represents a forward-thinking approach to addressing a pressing issue. The committee's work will help mitigate economic losses, reduce disparities, and promote resilience within the workforce and healthcare systems. Thank you, and I'll take any questions.
Thank you. Any questions? I'm sorry, Representative Weber.
Thank you, Mr. Chairman, and thank you very much for taking my question. I may have misheard you, but in one point in your introduction, you said about 4,000 people were affected with long COVID, and then you said that was 17% of our workforce. And those numbers don't seem to add up to me particularly well, because that would imply a workforce of about 25,000 people.
I think the 17%, actually, you're correct, referred to the 22,400 people in the report that have reported long COVID.
Okay.
They are not necessarily out of work. 4,000 are out of work, but
Gotcha.
22,400.
Okay,
so it was
that was
an
the
error on
disconnect.
my
Thank
part.
you.
Yes, thank you.
So the 22,400 is New Hampshire, right?
Correct. This is strictly on New Hampshire.
And as a follow-up?
A follow-up.
So it's 4,000 out of work and 22,000 some who have experienced it.
Correct.
Okay, got it. Thank you.
Correct. Thank you.
Representative Woods and then Representative Mazur.
Thank you, Mr. Chair, and thanks for taking my question. Being in the medical community, I certainly this is a very admirable project, but how does it differ from any other chronic disease that we face and the similar kinds of factors that come into play in terms of the workforce, et cetera, that you've outlined? How does this specifically different that would warrant a specific committee for this particular specific medical entity?
Thank you for the question, and that's a very good question. The reason that I believe that this committee should be set up is because we're seeing viral infections that we haven't seen before, like COVID. You know, it's not just the flu. This is ongoing. It's mutating, and perhaps this should be changed from long COVID to post-viral symptom disease, because there's so many out there. Bird flu is on its way. You know, we're going to have to prepare, and we're going to have to recognize that there are many individuals, myself included, have post-viral symptoms that are ongoing. So it's a valid point that there are many, many diseases out there, but this is one that is specifically hitting our economy greatly, and we need to address it.
Representative Mazer.
Yes, thank you. Thank you, Mr. Chair. Thank you for taking my question. Kind of off of what Representative Woods said, but so how do we know that these long-term effects of are they long-term effects of long COVID? How do we know that they're not long-term effects of the actual COVID vaccine?
I'm not sure how to address that. However, if you have long-term effects from the vaccine, if you believe you do, that would be, I would think it would fall under the umbrella of this. Long-term effects from COVID, whether it be the vaccine or the actual viral infection.
Follow up.
So I read the report, and it does mention the unvaccinated. So are the vaccinated going to be included in the study of this as well?
If you suffer from post-viral symptoms from a COVID infection, I would think you would be covered under this study.
Other questions? Representative McLean. Okay, Representative McKay.
Thank you, Mr. Chairman. We're all aware that the legislative leadership is very concerned that we keep forming committees, partly because they have to staff them. And I'm wondering if there's some other way of assisting in this issue without forming another committee, because the implication is that the public health community is not living up to their responsibilities. And I don't think that's at all what you intend. So that I wonder if there's some other way that we can help to deal with what is an important health problem without forming another committee.
I'm not sure what the question is.
The question is there some other way to help the public health community in their work without forming another committee?
Okay, so I understand the question, and what I can say is that finding some other way to help the community is exactly what this study committee is about. And in my committee where I sit, we're also warned about having so many study committees. However, isn't it our job to study and to come up with solutions for our constituents?
Follow up?
Follow up.
I think you answered my question. And the question is, how can we sell that on the floor? Because I agree that's a major problem, but we need some evidence that it's not being addressed and how to deal with it. Thank you.
Representative McLean, do you have your hand up? and then Representative Woods,
Yes, thank you, Mr. Chair.
and then Representative Palmer.
And thank you for taking my question. So I'm just curious as to the scope and where you see the need and, what is the area of focus going to be? Is the area of focus looking at improving the health outcomes, or is it more like you said that you're seeing gaps in coverage and people are out and so they're experiencing financial hardship? So you're really going to be focusing in on that area. I'm just trying to understand how expansive the scope is and where you envision it going.
Sure, if you look at, in the bill, lines 11 through 28, explain what the committee would be looking at. Specifically, my concern is the economic impact.
Thank you.
You're welcome.
Representative Woods.
Thank you, Mr. Chair, and thank you for taking my question. Just as you formulated this, were you familiar with the long COVID clinic at Dartmouth? I've forgotten, his name escapes me, but he started it right at the beginning of COVID. Did you work with him in terms of formulating any of this material?
I did not. And I'm aware that they have a clinic up there, and that could be part of it, is to make more people aware that there's a clinic, because a lot of people just don't know where to go. I mean, they're stuck with these symptoms and they don't know who can help them.
Representative Palmer.
So Representative Woods started with exactly where I was. It's Dr. Parsonet, and it is a whole interdisciplinary team that is working, and they're both available for treatment for people who think they have post-COVID, and they're also doing a lot of research, and so they may be looking into a lot of the questions that this committee would look at, and so it might be worth. I mean, it's definitely worth talking to those guys.
Thank you.
Other questions? Seeing none. Thank you.
Thank you.
No one else has signed up to testify on HB 58. Does anyone else wish to testify? Seeing no one, I am going to close the public hearing. I thought this might go on longer, obviously, given the nature of COVID and the interest and the concerns and the challenges that it presented to our country and our state. So it's sometimes hard to gauge how participation in a hearing. So I apologize for what's going to be a relatively long recess, but our next bill isn't scheduled to be heard until 11 a.m., House Bill 370. So we will be in recess for the next 45 minutes.
I think you better sit on the sidelines of that for a little while.
See what happens. Good morning. It's still morning, and welcome back to Health and Human Services and Elderly Affairs. Our next bill to be heard is House Bill 370. The prime sponsor is Representative Bernardi. He's not able to be with us, and he has asked Representative McLean, who is also a member of our committee, to introduce the bill. So, Representative McLean.
Thank you, Mr. Chair, members of the committee. My name is Mark McLean. I represent Hillsborough District 15, and I'm standing in for the prime sponsor of HB 370, Representative J.D. Bernardi. He's testifying in Commerce and Consumer Affairs as prime sponsor there, and he asked me if I could come in and read this testimony on his behalf. HB 370 reestablishes a commission to study the delivery of behavioral crisis services to individuals with mental illness whose impairment is primarily due to intellectual disability. The issue stems from the definition of mental illness found in RSA 135C:2X. Mental illness means a substance impairment of emotional processes or of the ability to exercise conscious control of one's actions or of the ability to perceive reality or to reason when the impairment is manifested by instances of extremely abnormal behavior or extremely faulty perceptions. And you highlighted this next section. It does not include impairment primarily caused by intellectual disability. And that's the root of the problem. Every year, there are about 10 cases of individuals who experience a significant enough behavioral crisis that they are brought to a local hospital. Those hospitals, without appropriate staff and services for these episodes, essentially just warehouse the individuals without treatment for up to 3 or 4 weeks before releasing them. There was testimony when the committee heard the bill last year, both pro and con, on removing intellectual disability exemption from the mental illness definition as a solution to redefining responsibilities within the system. This committee and the full House last year passed amendment language on a voice vote, which when it went to the Senate, they came back and they proposed a commission. The House concurred with the other body's amendment, and the governor signed a bill establishing the commission. The purpose of the commission was to identify appropriate procedures within the mental health services framework to ensure individuals experiencing a behavioral crisis and whose primary impairment is an intellectual disability receive adequate and timely treatment. However, the appointment of commission members by the governor was considerably delayed. You know, we were into the middle of October, and some members were never appointed. We were barely able to get a quorum. I was asked to serve as clerk on that commission, and the HHS representative actually said, "Do you even have enough people for a quorum?" And it had just come in that morning. And so given the deadline, which was November the 1st, everybody at the commission said, there is no time to do the work. We've run out of time. And so the recommendation was, you're going to have to come back. You're going to have to reestablish the commission. And so that's what this bill does. This bill reestablishes the commission with an adequate timeline to complete the task. And it was recommended when they did meet that one time that the report out date be pushed out with an interim report by November of this year, but the final report out to November 2027. It doesn't need to take that long, but it just prevents them running into the same problem that they encountered last time. So that is not the intention, but it was recommended by the folks on HHS. Maybe you should consider that with respect to the dates. So Representative Bernardi also says that individuals who testified in favor of the bill last session were not remarshaled, obviously, to advocate for the commission, and that was because he believed that the issue was settled by the creation of the commission in the first place, and so he was just basically asking now that it could be reappointed with the time to complete its task. And he will be available for questions after his testimony in Commerce and Consumer Affairs, but I don't know how that's going to go. But that's basically the main thrust of his testimony, and I'll do whatever I can to answer any questions on his behalf.
Thank you. So in other words, the commission never really did function, have a chance to do anything last time, right? As I understand it.
No, it just showed up. Like I said, we barely had a quorum with the last people being appointed that morning, but then we don't have time. So the recommendation of the commission was to reestablish the commission.
Okay. Representative Nagel.
I guess I'm very confused because I was on a commission on the behavioral health crisis services. Was that the commission I was on? All right, thank you. Because we did a lot. And they were called almost the exact same thing because I'm staring at the name right here.
Representative McKay.
Thank you, Mr. Chairman. I support this commission, but for different reasons. Our society generally has a prejudicial approach to mental illness and mental retardation. And the language that's in this bill is typical of what happens. It is very difficult to put the two categories together to say that mental retardation is the same as mental illness, but that's what this does. So I would hope that the commission would look into that. We understand in our society that there's a built-in prejudice against mental illness, and that's one of the difficulties of individuals who want to treat the mentally ill. If the commission could take that on, that is a monumental problem in our society. But I would strongly support looking into that, or at least getting it out into the public, that there is a difficulty in our society accepting mental illness and mental retardation, and that affects our ability to fund those programs. So here's another opportunity to get that out into the open. Thank you very much.
Representative Weber.
Thank you, Mr. Chairman, and thank you for taking my question. And my question is very specific to the bill because I'm trying to dredge up my memories of last time around. And am I correct in remembering that the real focus here was on the subset of individuals who, when they are taken to the hospital because of behaviorally inappropriate things that they have done, they are then told that they cannot be treated because they, as persons with developmental disabilities, are specifically exempted from the definition of mental illness. Is that, am I remembering that
Yes.
as the root of the problem?
Yes, thank you, Representative Weber. Yeah, that is correct. So if you have severe autism, for example, well, that's the primary driver here, and so that's what's driving the behavioral thing. So we're just not going to put you at New Hampshire Hospital. We're just going to warehouse you here, and ultimately the symptoms are going to subside or not, and then you're going to go back to your home without really having received any treatment.
Thank you. And a follow-up?
Follow-up.
Actually, I think that last phrase took care of my follow-up. So the specific issue was for these individuals, they're not receiving any treatment at all, or certainly no treatment that is in any way particularly appropriate to their situation.
And I think that's why Representative Bernardi used the word warehousing in his testimony.
Okay. Thank you very much for the explanation.
Representative Woods.
Thank you, Mr. Chair, and thank you for taking my question. I sort of have the same, how the categorization, and I'll use an example. Fetal alcohol syndrome may be sort of what we might streetwise say they're intellectually developed, but their decision-making is very aberrant. Would that be someone, and that is devastating to society, fetal alcohol syndrome, and they can have straight A's, some of them. But their frontal lobe capacity would seemingly fit. Am I understanding the differential you're trying to make?
I'm certainly not an expert, and I'm certainly not Representative Bernardi, but I believe that would be covered under what the commission would look at.
Yes, Representative Hartnett.
Thank you, Chair. Just a comment. I may be at a little bit of an advantage here, having provided the exact services in question 40 years ago, and now I do it again a day or two a week here at Riverbend. You've really described the challenge, I think, Representative Weber. It's really about what do you do with these 10 cases when you have an involuntary emergency commitment law that expressly prohibits people with developmental disabilities from being involuntarily committed. I think Representative McKay hit it on the head too, in that there you are at 3 o'clock in the morning in an emergency room with a 16-year-old who's behaving terribly, and diagnostically, you really can't reasonably sort out, is this a function of a developmental disability or some other psychiatric challenge? So these emergency rooms are just awfully stuck. And whether you have a seasoned psychiatrist, a seasoned emergency worker, working the case, you just simply can't sort it out that quickly. So the law does pose some real challenges. There's also a training issue for the people who are actually doing the work as well. Having done the work and having run in a psychiatric emergency service for a number of years, I can tell you your staff people are not trained to make these kind of subtle diagnostic distinctions in this complicated legal, arrangement as well. So I think it's a very good and reasonable thing to take a peek at and move forward with the bill.
Thank you, Representative.
Thank you, Representative Mazer.
Yes, thank you, Mr. Chair. And I'm not sure you can answer my question, but it was kind of off of what Representative Nagel asked or alluded to, that are there other commissions/committees out there right now that may be doing something similar that this can just be wrapped under instead of establishing a new commission?
I'm unaware of another commission that is working on this specifically, Representative. So I can't answer that question. There may be, but I am unaware of it.
Other questions? Seeing none. Okay, thank you. Would either of the individuals in the audience like to testify? I have no one else signed up. Okay, no one else wishes to testify. I'm going to close the public hearing on HB 370. Our next hearing is scheduled for 12:30 on HB 63. So we will be in recess until 12:30.
Eat the lunch bread. Oh, I'm sorry.
Good afternoon, everyone, and welcome back to the House Committee on Health and Human Services and Elderly Affairs. We have the next bill we have scheduled for public hearing is HB 63. Prime sponsor is a former member and former vice chairman of this committee, Representative Erica Leon, and she is already in position. Welcome back, Representative Leon.
Thank you, Mr. Chairman and members of the committee. I'm quite envious that you are all sitting on this committee with each other, but I'm also quite excited about my new opportunity in executive departments and administration. I represent the town of Derry, which is Rockingham 13, and I am here today with a bill that would have been brought to you by another former member, Gary Merchant. However, he was not victorious in his election. We can't let good policy fall to the wayside, so I am here today to help ensure that we can have access to the newest FDA-approved emergency epinephrine product, especially for children in the appropriate settings. So I've distributed 3 different pieces of paper to you. The first one here is why we're here. It's the FDA approval of this nasal spray. It's called Neffy as the brand name, so I might refer to it as Neffy a few times. Right now, we allow camps, basically summer camps or whatnot, and schools to have to administer this and to have the epinephrine on hand so that they could administer it to a student who needs it. Right now, our law speaks about auto injectors because until last August 9th, we had EpiPens, but we had no other way to get epinephrine into somebody who is experiencing an anaphylactic reaction. So this actually uses pretty known technology. It's using the same device as Narcan. So it's approved device that people already know how to deliver and is very, very easy to use. It's smaller, so it's easier to have on hand, and it actually has a longer shelf life. So it will be good at the camp or the school as long as they're not leaving it out in the sun in the field. It'll be good for 30 months. If they are leaving it out in the sun in the field or on the dashboard of a car, it's still good for 3 months. So if they want to be that aggressive and make sure that they have it out there on the ball field with them at summer camp, they can do it and just replace it each year since summer camp only lasts 3 months. So this seems like a really, really big and daunting bill considering that it is 9 pages long. But what it does is it adds nasal spray along with the auto injectors. I have been contacted by the New Hampshire Pharmacist Association because they noticed a little bit of a disconnect in these statutes and the ones that were passed last year that would allow them to allow the schools to stock the epinephrine, not specifically for any specific student. There was nothing in the pharmacy statutes telling the pharmacists that they could do it. So after a back and forth and some conversation, it was fine to let it happen. But when you're looking at school nurses and when you're looking at pharmacists, it's a lot easier to have this in their statute and say, that a pharmacist may dispense epinephrine auto-injectors and epinephrine nasal spray pursuant to a prescription issued in the name of a school, post-secondary institution, or independent school. A school under the direction of the school nurse may maintain a supply of epinephrine auto-injectors and epinephrine nasal spray for use in accordance with, and it's the school statutes. So that would just make it a lot easier and a lot cleaner. And there's a really, really big reason we want to make sure that we can do this. This company that makes this new nasal spray has a program to offer it to all schools, all K through 12 schools, public or private. As long as it's allowed by state law, they'll provide 2 boxes of it. So that's 4 of the nasal sprays. And they'll replace them. So this is something that's going to increase access to life-saving care in our schools at no cost to the state. There's another separate bill, House Bill 677, that's in Education Policy and Administration, that will be updating those statutes and dealing with that. But the job of this committee is to make sure that the pharmacists can do what they need to do and that we update the statutes on camps and schools in order to permit this new novel technology. So with that, I'm happy to take any questions.
Are there any questions? Representative Weber.
Will you be obtaining the official amendment, or should somebody from the committee do that?
I actually obtained one along with Representative Grota because she's a co-sponsor of the bill. She and I looked at it yesterday.
Sorry, I didn't get all the way down through I saw the one with the yellow thing, but you've already got, so this is the amendment
Correct.
officially that has the yellow language on it. So we
Correct.
have everything in front of us.
Yes, and
you
on
very
that
much.
second page where it's yellow highlighted, there's an asterisk which shows you where it fits into the larger
Right.
scheme of all of those laws.
Yep.
Because one without the other is sort of incomplete.
Right. Thank you very much.
You're welcome.
And
Although I don't,
thank you for this.
you're welcome. I don't know how long you need to retain that information unless you're the clerk, but it's good to see.
Representative Woods.
Thank you, Mr. Chair, and thank you for taking my question. This is obviously a needed entity and sort of a check-the-box type thing. My question centers around, doesn't seem to apply to industry. We don't necessarily have a big, huge General Motors plant here that might qualify to get such, but is there any consideration to include industry in the ability to have this available?
Thank you. That's actually a wonderful question. I think that would be going pretty far outside of the scope of this, but if you and I want to draft something for next year of this term, I'd be happy to do that because just like AEDs save lives, this also saves lives. And actually one of the other things is right now their list price is around $700, but they have an access where with insurance copays, it should get to $25. And they're working with GoodRx where it's $25, even if you don't have insurance. Those of you in the healthcare industry know how the list and actual need to be different.
Other questions? Seeing none? Okay, thank you.
Thank you.
Sure. Thank you.
I've got one. I should have.
I think she only gave you one.
Yeah, all right. Give me that one.
When in doubt.
As if you didn't have enough.
Also signed up to speak is Kristen Evans. It actually says judiciary on it. You meant? Okay. Sure, okay. Feel free to pull another, do you have enough room there, or do you need another chair? Okay.
Ma'am, can you spell your first name?
All right. So, dear members of the committee, for the record, my name is Kristen Evans, and I live in Pelham, and I am here today as a parent, so not in my official job. For me, I'm here to express my full support for House Bill 63. For me, this isn't just legislation, it's life or death. My 17-year-old son, Truman, has life-threatening allergies, and every day I live with the knowledge that a single mistake, a single exposure could change our lives forever. When Truman was first diagnosed, I quickly learned how fragile safety is. Seconds matter during an anaphylactic reaction. Those precious seconds can mean the difference between life and death. Yet hesitation or fear in administering epinephrine is all too common, especially for those who care for children. These are the people who may find themselves in the position to save a life, and we need to give them every possible tool to act with confidence and without delay. Today, Truman is here with me, and he will share his own perspective about what it's like to live with the constant risk of anaphylaxis. I've also brought with me the 3 types of epinephrine devices we rely on to keep him safe. I have the traditional auto-injector. This is the needle. The AviQ auto-injector. This one talks to you when you open it. So it walks you through it, which is nice, but those are usually hard to get. And then we brought the Neffy. So if anybody wants to see what it looks like, we also have the Neffy. So the Neffy is small and portable and simple enough for anybody to use. The bill is not just about convenience. It's about empowering caregivers to save lives. It's about ensuring that when the unthinkable happens, those who are entrusted with the safety of our children have the tools they need to act immediately and effectively. I urge you to pass House Bill 63 for every child who depends on others to protect them in crucial moments. Thank you for your time and thoughtful consideration.
Thank you. Do you want to take questions, or would Truman like to go ahead, and then we can ask
We'll
them,
do it all.
for both of them?
My name is Truman, and I am 17 years old, and I live in Pelham. I'm here today to share why passing House Bill 63 is so important.
Could
to
you
me.
maybe get closer to the mic?
I'm sorry about that. My name is Truman, and I am 17 years old, and I live in Pelham. I'm here today to share why passing House Bill 63 is so important to me and others like me who live with life-threatening allergies. Since I was young, I've had to carry an EpiPen everywhere I go. It's just a part of my life, but that doesn't make it easy. Living with severe allergies means I'm always thinking about what I eat, where I go, and whether the people around me are prepared to help if I ever have an anaphylactic reaction. It's not something I can ever take lightly because I know how quickly an allergic reaction can turn into an emergency. Even though I carry an EpiPen and know how to use it, there's always the chance that I might not be able to administer it myself. In those moments, I have to trust the people around me can step in and help. But I know how intimidating that can be for someone who has never handled an EpiPen before. That's why House Bill 63 matters so much. Allowing schools, camps, and other places to use epinephrine nasal spray would make a huge difference. The nasal spray is easy to use and doesn't involve a needle, which can be scary for people who aren't used to giving injections. In an emergency, when every second counts, I've had something simple and straightforward can save lives. I try to be prepared for anything, but I also know that I can't do it all on my own. Passing this bill would mean that the people I trust to look out for me would have an easier way to help if I ever needed it. It's about making sure that no one hesitates when there's a tool that can make acting quickly less overwhelming. I hope you will consider how important this is, not just for me, but every kid like me who relies on others to step in during a life-threatening situation. Thank you for your time and for listening to my story, and I am open to answering any questions you have.
Great, thank you. Any questions? Seeing none, okay. Representative Weber.
This is a little out of the way, but I was just wondering if the two of you would like me to take a picture and email it to you so you'd have a record of your testimony, but I didn't want to do it without your permission.
I appreciate that.
Great job, Truman. Great job. I love your name too.
Thank you.
I gave it to him. Do you want to look at the Neffy? Do you want me to pass it around so you can see?
I would, yes.
I could want to pass all three.
Yes, Representative Delamus.
Thank you, Mr. Chairman. This is a would you believe. Would you believe that I actually found myself on the floor of a bathroom of a restaurant, I think it might have been last Sunday or the Sunday before. I'd eaten something that I didn't realize was going to react, and I don't have anaphylaxis, so I don't need the epinephrine, but I was on the floor and I didn't have my phone, and I was on the floor for I don't even know how long. I finally was able to get up off the floor and get to my husband, who brought me home, and I suffered for three or 4 days. So I know what it's like to have terrible allergic reactions to foods and environment. So I'm glad you guys are bringing this to us.
You're welcome.
Very scary.
Are there any other questions? Any other? Seeing none, okay. Thank you very much.
Thank you.
Thank you.
And we'll get these items back to you shortly, momentarily. I have no one else signed up to speak on HB 63. Does anyone else wish to speak? Seeing none, I'm now going to close the hearing, public hearing on HB 63. Our next hearing is scheduled for 1:15 on HB 126, so we'll be in recess.
We're being so efficient today.
Representative Weber moves ought to pass. And Representative DeLema seconds. Sure. Representative Weber.
The amendment is, now I've lost my pieces of paper again. 2025-0067H, and it simply allows supplies to be kept on hand that have not been prescribed for a specific individual. And because it's quite possible that individuals go into an anaphylactic shock the first time and don't have anything, having them on hand is very important. So I would move the adoption of 2025-0067H.
Okay, thank you. Representative DeLemus, do you wish to speak to your second?
I fully support.
Microphone.
Oh, sorry. Thank you, Mr. Chairman. I fully support the amendment as well as the bill itself, the body of the bill, because of the fact that it introduces a new method of delivery for important epinephrine in case of anaphylactic shock due to all kinds of allergies.
Okay, is there any other discussion on this motion? Again, the motion is, Representative Woods.
Thank you. I would just like to offer further support. My daughter is a para at a local junior high and worked with kids who don't have sufficient support, but oftentimes with their other disabilities have allergies which may or may not be known.
Right.
And this occurred just last week with her. And without this kind of availability, this kid would have died.
Okay, thank you. Any other discussion? All right, seeing none, I'll ask that the clerk call the roll. Again, the motion is ought to pass on amendment to House Bill 63, amendment number being 2025-0067H. Mr. Clerk.
Call the roll. Please say yes or no.
No, you have to go, yeah, that's right.
Rep. Mazur,
Yes.
Rep. McLean,
Yes.
Rep. DeLemus.
Yes.
Rep. Kofalt is not present. Rep. Nagel. Present. Rep. Polozov.
Yes.
Clerk votes yes. Rep. Markell.
Yes.
Rep. McGrath.
Yes.
Rep. Ober.
Yes.
Rep. McKay.
Yes.
Rep. Woods.
Yes.
Rep. Palmer.
Yes.
Siebert.
Rep. Siebert for Rep. Tellez.
Yes.
Rep. LaMontagne.
Yes.
Rep. Hartnett.
Yes.
Rep. Lucas.
Yes.
And Chairman McDonald.
Yes.
Okay, that makes the vote 16 yeas, 0 nays. Motion passes.
Okay, thank you. Representative Weber,
You had your hand up first. I'm happy to defer if you.
Representative DeLemus, you want to make a motion of ought to pass as amended?
Yes, motion to pass as amended.
Okay,
Okay, and also I'd like to move to have it put on the consent calendar.
okay, well.
That's
yeah,
later.
that'll-
Okay,
yeah,
sorry.
Okay. So a motion's been made by Representative DeLemus of ought to pass as amended, and Representative Weber seconds. Do either of you wish to speak to your motion? I think we've already covered it. Okay, so again, the motion is ought to pass as amended on House Bill 63. When you're ready, Mr. Clerk.
We get. All right, we'll call the roll again. On motion ought to pass as amended, as amended. Rep. Mazer,
Yes.
Rep. McLean,
Yes.
Rep. Delamus?
Yes.
Rep. Polzov?
Yes.
Clerk votes yes. Rep. Markel?
Yes.
Rep. McGrath?
Yes.
Rep. Weber?
Yes.
Rep. McKay?
Yes.
Rep. Woods?
Yes.
Rep. Palmer?
Yes.
Rep. Siebert for Rep. Telez?
Yes.
Rep. Lamontagne?
Yes.
Rep. Hartnett?
Yes.
Rep. Lucas?
Yes.
Chairman McDonald?
Yes.
Vote is 16-0. Motion passes.
And Representative DeLemus.
Thank you, Mr. Chairman. I move that we put this on the consent calendar.
Okay, if there's no objection, we will put that on the consent calendar. All right, excellent.
Congratulations.
Okay,
Excellent start.
That means you have to write the report.
so help me out here.
Yes,
Delamus
okay,
is-
who's writing the report?
Representative DeLemus.
I love it.
And again,
Yes.
could I get that, Representative DeLemus, could I get that in the next day or so? So, if you can just send me an email,
Yeah, you just write your own.
usually just indicate, what the vote was.
It is. It's so.
I usually just get emails from
It's a lot
people.
easier for people if you email them, then they don't have to retype it. They can just cut and paste.
Yeah, state the motion, the vote, and
It's all new to me.
So it's who moved, who seconded.
Right, yeah,
what
oh, I
vote
know that,
was.
but I mean, it's, this,
Yeah.
no paper.
Yeah, no, I always just make it up on a form. And that way I have a record of what I
So I
wrote.
take a picture of this and send it to.
Although our chairman has been very considerate.
you need,
of
you
the
need,
members of this
you
committee.
need this separate. You
There
need
are chairs
the-
who
well,
might change
see,
things.
the way I usually do it, and I think the way you're supposed to do it is the motion would be OTP for just the
Well,
amendment. And then it would be the bill number,
I mean, it wasn't in
OTPA,
the rules, but
and then the
to
vote.
change something
Alright.
over somebody's signature.
That's
Okay.
usually, I
So
believe you're supposed to list them
when-
separately. I always did.
When either Speaker Norelli or Speaker.
guess that's the advantage of pencil.
Speaker.
Yeah, actually.
But you've got
we
plenty
were
either way.
commanded
Yeah.
To either.
Because sometimes an amendment
the
fails, but the
person
bill
to change.
passes.
Or as chair, you could
Okay,
say,
so that would just be.
you're not writing this, I'm writing this. But you couldn't.
OTP on the
change
amendment
Yeah.
only, yeah.
Right.
Oh, well, that's right.
And again, there were separate people making the motions too. Lucy made
Yeah,
the
but
amendment.
it doesn't,
And
I
you
mean,
know, I don't think that's ever
wouldn't
gonna
they,
be a
ma-
problem.
if they wanted that, would they put that on here? Doesn't the
And
clerk
we
just get
do
that?
often collaborate.
Well, he has information too, but again, the vote on the amendment sometimes is different than the vote on the full bill too.
Right.
Sometimes an amendment will pass, but the bill will fail. The
So
OTPA
then-
will fail.
So then this is OTPA.
OTPA,
One
right.
down, 36 to go, or whatever it was.
Well, 34. I thought it was only 34.
Yeah.
The EpiPens are already
Well,
available,
and-
have been forever. If there's a new, better way or
Yeah.
a great way to deliver the same drug to help save someone's life, it just makes sense.
Yeah, and it's so nice to just be
Okay,
able to
and
put
actually, it
the
was Lucy
same-
that made the motion on the
add the
amendment.
language in everywhere it appears in the statute.
Right.
Lucy made the
I mean,
motion
it
on the
looks like
amendment.
it's a huge amount.
She
of
made the
work,
motion on
but
the, and she'll be
just
writing the report.
getting that done.
Who?
Delamus,
Yeah.
Representative, but she didn't make the motion on the amendment.
No, I know, but it doesn't say on here, it doesn't ask you who made the motion.
Right. Usually they're one and the same, but, so, anyway.
I'll send this and see if they have a problem
Okay,
with it.
all right. It'll be easy to
Verify.
change, yeah.
This looks great. Consent calendar, yes. Minority report, no. None of that, and then I signed here.
Exactly.
All right. I'll text this to Sean and see if it.
Okay.
I wasn't planning to speak, but he's not here, so.
If you want, sure. Let me, I'm going to adjourn the executive session on House Bill 63. We have concluded that business, and it is now 1:15 p.m., so I'm going to open the public hearing on HB 126. The prime sponsor is Representative Papavici Muller. He is not present, but one of the co-sponsors is Representative Dan McGuire. And thank you, Representative McGuire, for being here. It works out well.
Yes.
We will need a pink card from you after your testimony, or before, either one.
Yeah, I'm sure he's coming, but anyways, thank you very much, Mr. Chairman, members of the committee. For the record, my name is Dan McGuire. I represent the town of Epsom. This bill is kind of a follow-on to a bill that we passed last session that was sponsored by myself and Representative Popovici Muller and Representative Merchant. I guess former Representative Merchant. And so that bill was to put an exception into law for certain testosterone treatments that were of gel form. So testosterone, if you don't understand, is a kind of another word for steroid, and so when men, typically older men, have a low testosterone, they're prescribed testosterone treatments, and kind of the lowest level of that treatment is a gel form, and so. It's the kind of treatment, it's a kind of situation that doesn't get cured, it just gets managed, sort of. And so once you're on these kind of treatments, you're essentially on them for the rest of your life, or until, you know, at some point maybe you wean yourself off, or you're too old to use it, I don't know. But in any case, it's for long periods of time. But the problem was that because chemically, steroids and testosterone are essentially the same thing, or they're in the same category. They're a class, I think it's class 2 drug. And so you're only allowed in general for this class of drugs to get a 1 month prescription. Well, that means you're on something for the rest of your life or a long period of time. You're going to pay 12 co-pays instead of the normal 4. It's just the hassle of re-upping your prescription frequently and ordering stuff frequently and all that sort of stuff. So the legislature was kind enough to put in an exception for these kind of gel treatment testosterone. So Representative Popovici Muller wanted to expand that to injectable testosterone, which is kind of, if the gel form is sort of not enough for you, right? If your situation is such that it's not strong enough for you, I guess, then the next step is this injectable form, and it's essentially the same thing, but he put into this that you have to have had your prescription, your monthly prescription, for 12 months. So you're on it kind of regularly. You've been doing it for 12 months before you can move to a 90-day, I guess it's technically a 92-day prescription. But it's essentially the same issue, the same drug, et cetera, but it is a stronger version of this drug. But it's only prescribed to people who really need it and would use it in a regular way. So.
Okay, thank you. Any questions? Yes, Representative McGrath.
So I'm a retail pharmacist, and this 12-month monthly prescription before you could get it would be a nightmare to manage in a retail pharmacy. People don't go to the same pharmacies. We have, if they might be from out of state, that is a nightmare situation for pharmacists.
So thank you for the question, Representative. So I guess your question is sort of, how does the pharmacist manage, how do they know that a person has has had a 12-month prescription? And I guess they would have to maybe call the person's, do you ever call the person's doctor and say, have you given them 12 months? So I think the doctor is the one who makes the prescription, right? So doesn't the doctor say, now I'm giving you 90 days? So the doctor would have to know, okay, I'm giving you 1 month, and so on. Okay, you've hit a year. Now I'll start giving you 90 days, correct?
Follow up?
Thank you. Yeah, I mean, if it's on the doctor and the pharmacist can just assume that the doctor is following the law, then that would work, but it often falls on the pharmacist. So I guess the question would be, you know, is there any language that can go in there to make it so the doctor's the one that has to follow up on following that law?
Yes, thank you for the question. I guess that's a level of detail that maybe I can't answer quite right, because you're right that this reads as though it's the pharmacist who's in charge, right? Because it says may be filled for a 90-day supply. It doesn't say may be written for a 90-day supply, right? So maybe this is a detail that Representative Popovici-Muller would have to maybe bring an amendment for you or something like that. I'm not sure I don't know whether he's thought about this or not.
Representative McLean.
Thank you, Mr. Chair, and thank you for taking my question. You may have mentioned it in your testimony, and I might have missed it, but why is the prior 12 months essential? Why not just go straight to the 92 days?
Yes, thank you for the question. So I think the whole point of this is to kind of avoid the everybody's fear with prescription drugs is that patients will doctor shop and go here and get a prescription and then go there and get a prescription and go over here and get the same prescription, and all of a sudden they've got these dangerous drugs in way more volume than they should, right? So I think the concept here is that you've been going to the same doctor for a year. He's seen you for a long time. You've gotten those 12 monthly prescriptions. And so you're a regular person, right? I mean, you're a regular patient of this thing. You're not somebody who's, I'm here the first day and all of a sudden I want this big quantity. I think that's the concept of it.
Any other questions?
And may I add to that slightly? The reason that wasn't an issue with the gel version is because the gel version is so weak that a 90-day supply is not it doesn't build big muscles or whatever. You see what I mean? I'm a patient who uses the gel version, and my doctor once made the comment to me that if you want to abuse this stuff, you would need a bathtub full. A couple of bottles isn't going to do it, right? And these are not cheap drugs. I mean, these are like, technically the bottle is $100 or more, right? So it's anyway.
Any other questions? I'm seeing no other. Representative Valentine, did you have your hand up?
Thank you for taking, Mr. Chair. And thank you for taking my question, which I don't know that much about this, but is part of it in order to monitor patients taking this injection for side effects, which might be harmful?
Possibly, but I guess that's beyond my knowledge. I'm not a doctor, so I suppose it's possible, but I don't think so. I think it's more about the class of drug. We have this system of certain drugs you just simply can't have. Some drugs you can get, but only in the hospital. Some drugs you can get with a very short prescription. Other drugs you can get with a normal prescription, and other things are over the counter. You know what I mean? So there's a classification system, and I think it's just kind of where this particular one lands, right? It's possible, but I don't think so. I've never, let me put it this way. For my condition where I've been given testosterone, I've never had a doctor want to see me more than once a year, right? So, you know, I mean, it's a very slow moving kind of situation. You know what I mean? You see a very specialized doctor, you see them once a year, they say, okay, you know, things are about the same. And, you know, it's like that.
Other questions? I'm seeing no other questions. Thank you.
All right. Thank you, Mr. Chairman.
And again, the pink card, there you go. Representative Murphy, Mr. Thomas, do you wish to testify on this bill, HB 126? Good to see you, Representative Murphy. Thanks for coming in. If no one else wishes to testify, I'm going to close the public hearing on HB 126. That is the last public hearing. Did I hear something? Oh, okay. That is the last public hearing we had scheduled for today. We will be coming back tomorrow, next week, next Wednesday, for another day of public hearings. Until then, we will be adjourned. Thank you.